Hello, everyone. Thank you for joining us. My name is Dr. Lauren Munsch Dal Farra, and I'm a cardiologist and the CEO of Calm Health. We're here today to discuss how we can work on achieving calmness through our understanding of the mind-body connection. In this presentation, we're going to cover understanding stress at both a physiological and a psychological level. We're also going to discuss how the brain and heart react under stress and communicate with each other, the impact of our emotions on our heart and brain, and techniques to regulate and positively impact our emotional responses. By understanding how stress influences our body and mind, we can positively modify its impact. So let's first take a look at what is stress. Stress is a normal reaction the body has when changes occur, resulting in physical, emotional, and intellectual responses. When you experience changes or challenges, stressors, your body produces physical and mental responses. Stress is a normal reaction that happens to everyone, and in fact, the human body is designed to experience stress and react to it. Stress responses help our body adjust to new situations. Stress can be both positive, keeping us alert, motivated, and ready to avoid danger. So for example, if you have an important work deadline coming up, a stress response might help your body work harder and stay awake longer and be more focused. But stress becomes a problem when stressors continue without relief or periods of relaxation. Here we are looking at a stress bell curve, where too little stress causes boredom and inactivity, and where optimum stress results in focus and motivation. Stress overload, on the other hand, leads to fatigue, exhaustion, and eventually anger, anxiety, panic, and burnout. So let's dive a little bit deeper into stress overload. On a psychological level, stress overload is what we feel when the demands imposed on us exceed our ability to cope with them. This is when we're really just feeling like the weight of the world is upon us. On a physiological level, stress overload is a state in which heart rate, muscular and arterial tensions, and the secretion of cortisol and adrenaline all increase independent of physical exertion. Our body is actually stacked to look at stress and do one of three things: fight, flee, or freeze. This is called the fight or flight response, and it occurs when we perceive that we are under excessive pressure or stress. Physiologically, we experience increased metabolism, elevated blood pressure, a faster heart rate, quicker breathing, a dilation of our pupils, and constriction of our blood vessels. All this is a result of our autonomic nervous system working. Our autonomic nervous system regulates a variety of body processes that take place without conscious effort. The autonomic system is part of the peripheral nervous system, and that's the part that's responsible for regulating our involuntary body functions. These are things like our heartbeat, our blood flow, our breathing, and our digestive. There's three branches of the autonomic nervous system, but the two main branches are the parasympathetic nervous system. And you may have heard of this as kind of responsible for the body's rest and digest function. And the sympathetic nervous system, which controls the body's responses to a perceived threat. And that's what's responsible for our fight or flight response. The human brain is actually a fairly old piece of equipment, and it functions much like it did for our ancestors 1,000 years ago. The adversity that our distant ancestors faced were typically life or death. Our bodies today function the same way, even though the stimulus has changed. So instead of being chased down by lions, tigers, or bears, our current society imposes on us other stressors, like excessive traffic, excessive noise, dramatic news reporting, heavy pollution, crowding, and criticism. If we go into attack mode, if we go into attack mode, every time that you cut off in traffic, stress is going to have a severe impact on you. Your body's response to stress is supposed to protect you, but if it's constant, it can harm you. Anger is an emotion that triggers this fight or flight brain response in the same way that a threat of a bear or a lion used to trigger it in our distant ancestors. If a person experiencing anger will also experience increased heart rate, elevated blood pressure, and increased levels of adrenaline and noradrenaline. Symptoms of stress, anger, and anxiety can result in both bodily symptoms and mental symptoms. So people may experience chest pain, shortness of breath, heart palpitations, dizziness, nausea or abdominal pain, sweating, trembling, dry mouth, muscle tension, and fatigue, all as a result of anger or anxiety or heavy emotional responses like fear. Mentally, people may experience anxiety, irritation, loss of control, impatience, anger, a feeling of hopelessness and forgetfulness. So to better understand how we can calm our body and how we can calm our mind and reduce the effects of stress overload, we need to first gain awareness of how the heart and brain respond to stress and how they communicate with each other. So we're going to dive deeper into understanding our brain, our heart, and how they work together. Let's take a look at the brain. There's three main kind of systems of our brain. The first brain is referred to as our reptilian brain. This is the part of the brain that controls our body's instincts, reflexes, and vital functions. The second brain is often referred to as our emotional brain, or the limbic system. It's involved in most of our feelings and emotions. It stores in its structures and circuits all the memories, feelings, and emotions. It makes it possible to recall the meaning and perception of past events. And as a result, we can learn from our mistakes and our successes. And then the outside layer, our third brain, is our cortex. And this is the part of the brain that enables various functions like reasoning, problem solving, and goal setting. It facilitates planning, optimization of choices, and the management of our second brain when we're working in harmony. It's the part of our brain that allows us to be in harmony with our awareness. These three brains that we just reviewed interact continuously and should be in sync. But too often, we only use one level of our consciousness. For example, if the first brain, our reptilian brain, is dominant, we react instinctively without considering the consequences, the environment, or other people. When the second brain, our limbic system, our emotional brain, is predominant, our uncontrolled emotions will direct our actions. And this is the most frequent case because, in fact, it's been shown the nerve connections going from our second brain, our limbic emotional brain, to our third brain outnumber those going in the opposite direction from our cortex to our emotional brain. So the third brain, our cortex, often has trouble regulating our emotional brain. And when the two don't work together, emotions can become too strong because we don't feel like we have a sufficient amount of awareness to manage them. A key aspect of regulating our emotional brain is our amygdala. This plays an important role in our emotion, in our behavior, in our processing fear. The amygdala is this little structure in neon green on this slide, and it rests in our second brain. It registers all types of stimuli and it associates them with past memories. This association triggers automatic responses. The reactions may no longer be appropriate to the current situation, but because they arrive so quickly into the emotional brain, our third brain, our cortex, doesn't have time to become aware of them. These triggering factors may give rise to an exaggerated emotion through its association with other past memories. So you have a classic example of someone walking down a path and there's a rope on the path. As soon as the color and shape stimuli the brain and register in the brain, you associate that object with a past memory, for example, of a snake. Your amygdala is what causes you to jump before your cortex processes that the object is actually a rope. Therefore, it's your amygdala that's responsible for the often and very true saying, "I didn't think, I just reacted." The amygdala makes instantaneous decisions about the familiarity of incoming sensory information. And because of its extensive connections to the hypothalamus and other autonomic nervous system centers, it's able to basically hijack your neural pathways, activating an automatic response and an emotional response before your higher brain receives the sensory information. So all sensory data, except curiously the sense of smell, is sent by the body first to the thalamus, which is also in your emotional brain, which acts like a switchboard, sending information to different relevant parts of the brain. Data from the thalamus is sent to the amygdala and to the relevant part of the cortex for processing. When information is sent to the cortex, we of course think about it. The problem is sometimes there's no time to think because the pathway from the thalamus to the cortex is slower than the pathway from the thalamus to the amygdala. This is a mechanism that's really meant to protect us because, in fact, if you're thinking too much and there's a danger, this could leave you dead. So it's your amygdala that does a quick threat assessment of any information getting sent to it. It compares all that information with stored memory responses of fear or other stimuli. It makes quick associations, and when it's triggered, it allows us to act. If this fear response is triggered, the amygdala floods the cortex with chemicals to stop the cortex from taking over so the body can react. So the result is that we act without conscious thought. For example, we jump out of the way of a falling branch, or we dive into the river to save a child. That's why our reptilian brain and our limbic system are referred to as our fast brain. And our conscious, aware brain, our thinking and reasoning brain, is referred to as our slow brain. Now that we've had a chance to review how our brain processes information, we're going to talk in more detail about the heart. The heart is a complex and independent information distribution center. The heart is the body's main energetic power station. It generates 2.5 watts. It produces 50 times more energy than the brain. Using the electrocardiogram, sometimes referred to as an ECG or an EKG, you may have heard about it, we can measure the power of these electrical waves anywhere in the body. The heart is a very powerful oscillator, and it sets the rhythm for the whole body, the cerebral, nervous, respiratory, hormonal, and other systems. And therefore, our heart rate has a very strong influence on the whole body and its functioning. To better understand the heart, we're going to talk about how the heart communicates with the brain and the rest of the body. The heart communicates with the brain and the rest of the body in 4 main ways. It communicates neurologically through the nervous system. It communicates through hormones. It communicates through pulse waves, which we refer to as biophysical communication. And it communicates through electromagnetic fields, which we refer to as energetic communication. And we're going to look at each of these forms of communication in more depth together. So on a neurological level, you may have heard of the vagus nerve. The vagus nerve is part of the autonomic nervous system, and it originates in the brain and branches out to the neck, the torso, the diaphragm, and the digestive system. The vagus nerve is really kind of known as the body's information superhighway. It carries information from the heart and other internal organs to the brain, and it's also responsible for sending signals back from the brain to the heart and the gut. Some of these signals are known as sort of the parasympathetic or rest and relax signals. What's interesting about the vagus nerve is that, in fact, 80 to 90% of the nerve fibers in the vagus nerve are dedicated to communicating the state of your viscera, that's your gut and your heart, back up to your brain. So while the signals are bidirectional, the majority of them are moving from your heart to the brain. So the heart and gut are sending more signals to the brain than vice versa. At a biochemical level, the heart secretes a number of hormones. And this is another way in which it communicates with the brain and the body. Although not historically typically thought of as an endocrine gland, the heart actually manufactures and secretes a number of hormones and neurotransmitters that have a wide-ranging impact on the body as a whole. And we're learning more and more about this and these different hormones that the heart produces. For example, the heart produces atrial natriuretic peptide, ANP, which is the hormone responsible for fluid and electrolyte balance. It also produces norepinephrine and epinephrine, which regulate your blood pressure, your heart rate, your blood sugar, and your fight and flight response. It also produces dopamine, which you may know of as sort of the pleasure and reward hormone. And then interesting, the heart also produces oxytocin. We used to think oxytocin was just produced by the brain, but new research shows that beyond its well-known functions in childbirth and lactation, oxytocin is also involved in cognition, tolerance, and trust, and it's produced in concentrations in the heart in the same range as those produced in the brain. So the heart has a lot of interesting functions in both producing and circulating many of our main hormones. Another way in which the heart communicates is through pulse waves. So pulse waves are generated by each heartbeat. They result from changing levels of blood pressure due to that pump activity of the pump function of our heart. So every time the heart squeezes, there's a pulse wave created. We should be aware that these waves are not representing the flow of blood in and of itself, but they're waves that are spread through our circulatory system much faster than blood each time that there's a contraction of the heart. And these waves are what allow the enlargement of the arteries and generate electrical activity in certain cells. So to kind of understand this difference between the pulse wave resulting from the contraction of the heart versus the flow of blood itself, imagine children making waves on a rope. It's only the waves of the rope that travel back and forth, not the rope itself. These waves are constantly sending information to our body and our brain. And we can measure them in different parts of our body, such as in our aortic root, in our carotid arteries, in our brachial and radial arteries, and they'll take on different forms and shapes, depending on the pressure that's created in those different areas of the body. And then what I find most fascinating is the electromagnetic communication of the heart. Research suggests that the heart's magnetic field is another important carrier of information. The heart's magnetic field is the strongest rhythmic field produced by the human body. It not only envelops every cell of the body, but it also extends out in all directions up to 3 meters into space around us. Every organ has a magnetic field, but the heart's is the largest, and it can be measured several feet away from the body by sensitive magnetometers. I find it most fascinating that the heart receives information through its magnetic field, and the heart also transmits information through its magnetic field. So now that we've had a chance to look at how our brain functions, especially in the face of different emotions and stimuli, and how our heart communicates, we're going to put the two together and understand how the brain and heart work together. So we looked at the vagus nerve and we saw that the majority of information is actually being sent through those nerve fibers from the heart to the brain. We looked at other forms of communication in our pulse waves, in our hormones, in our magnetic field. And basically what we can say is that 65% of the messages between our two organs actually travel from the heart to the brain. Information sent by the heart is first received by our first brain, our medulla, that reptilian brain that we looked at, and then it moves to the second brain, our limbic system, our emotional brain, where it's registered by the thalamus, and then information is sent out to the amygdala and to the cortex. It's the form and pace of these signals sent from the heart, the waveform, so to speak, that we're going to look at in more detail in a minute, that's ordered or disordered, that will inform our brain to some extent. What's interesting about humans is that we do have that cortex, that third brain, and we can learn to self-regulate. We're not limited to just these automatic responses of our nervous system. We're not limited to just fight, flight, or freeze responses. So the healthy functioning of our brain and our heart-brain communication depends upon the proper functioning of our vagus nerves and the other systems which we looked at, but the vagus nerve, which can slow the heart rate and help override stress hormones. So in other words, we can learn to calm ourselves and inhibit messages that stimulate a physiological flight or fight response, stress response. And so to understand how we can do that, we're going to discuss something called heart rate variability. We now understand that the brain receives information from the heart and vice versa. And so we ask ourselves, how can we maintain balanced perspectives and both react properly and adapt to stressors in a tempered manner that doesn't always place us in emotional overdrive? And to understand that further, we're going to look at a concept called heart rate variability. Heart rate variability has been highlighted as the most effective and objective physiological measure of stress and one's overall emotional well-being. And how it's defined is the variation in time between each individual heartbeat. So it's measured by the variation in our beat-to-beat interval. And that's not something we typically look at or talk about in the daily practice of medicine. It is something we look at in understanding fetal health, and if a baby is in distress while it's in the womb, and we look at this very carefully post heart attack in people. But what the difference between your heart rate and your heart rate variability is that if you look at our bottom graph, where you see in red, that represents sort of a rhythm strip of an electrocardiogram. And when you check your pulse, you typically measure the number of beats over 30 to 60 seconds. So you're looking at an average frequency over a longer period of time. But within that 60-second interval, there is variation in the distance between each beat. And that's what we see on our blue line here. So these small irregular behaviors and differences in our beat-to-beat variation are not readily detectable when we measure our heart rate over 30 seconds or 60 seconds. But if we examine them on a beat-to-beat level, we can see that there's a difference in the interval between each beat. There's fluctuations. These fluctuations in our heart rate result from a lot of complex interactions that are happening among a number of different physiological systems. So on this particular graph, you can see that the time between each of the heartbeats changes. And in this first window of 0 to 13 seconds, the distance between the beats is becoming progressively shorter. And then after 13 seconds, the distance between the beats is becoming progressively longer. We may measure this person's heart rate over 30 seconds or over 60 seconds and come up with the same average beats per minute. But what we can see is that there is variation in the beat-to-beat interval. And this variation is referred to as our heart rate variability. And it's a very strong indicator of if we're in cardiac coherence or cardiac incoherence, which we're going to talk about further in these next few slides. So cardiac incoherence is when our body enters a state of mind-body incoherence in moments of stress or anger. And our heart rate variability waveform, so that beat-to-beat interval waveform, looks like a series of uneven, jagged peaks. And we can see that shown below, taken of a person during an example of when someone's in frustration. Going back to our review of our neurologic system and our brain and heart, physiologically, what's happening here is that our branches of our nervous system are generating signals that are not synchronized with each other. So when these signals, when we're frustrated, we're angry, and our beat to beat interval is jagged, these signals reach our thalamus. They travel from our heart back up to our brain, forming a disordered curve. And when the thalamus is registering a very disordered curve, it's sensing more of a threat, and it's sending more signals to our amygdala. So we are not triggering our cortical functions as much, and we don't as easily adapt to our present circumstances and assess things coherently. Biologically, what's happening is that stress and anger can cause a number of different functions. The liver produces more cholesterol. Bile production can become imbalanced. Blood stagnates in the liver, reducing its ability to detoxify. Hormones and nerve activation lead to more vasoconstriction of our blood vessels, which causes elevated blood pressure. This also leads to increased inflammation in the arterial walls and increased cortisol levels, which lead to increased blood cholesterol, increased triglycerides, higher blood sugar, and higher blood pressure. So we can already see that the biology of negative emotions is having health consequences, and how this can manifest in these chronic states of stress and emotional states can really dramatically influence our health, and has been implicated in a number of different diseases and illnesses, including depression, fatigue, premenstrual symptoms, high blood pressure, diabetes, and then of course causing plaque to build up in the arteries and heart attacks. Not a situation we want to be promoting and inducing through our emotions. So this leads us to kind of take another view on, if anger and frustration and stress have so much detrimental effects, what is the effect of joy and happiness on the cardiovascular system? So we're going to turn our attention to this and see what happens when our body enters into a state of joy, happiness, and positive emotions. And this heart rate variability waveform looks quite different than the previous one we saw. And when the body enters into a state of joy and happiness and positive emotions, we form waveforms that are more harmonious. We have smoother curves, higher amplitude and consistency. And so physiologically, this indicates that both branches of our autonomic nervous system are synchronized and functioning more efficiently with each other. Positive emotions in general increase the coherence of our nervous system signals and improve the biological responses in the body. When our nervous system is functioning in a harmonious rhythm, we become more efficient and experience less fatigue. And it's been observed that 5 minutes of solitude and calm will have a long-lasting effect on our cardiovascular system, whereas alternatively, 5 minutes of anger suppresses our immune system by 35% for 6 hours. So we can already begin to see that positive emotions have a beneficial impact on our health, and they also correlate with other healthy lifestyle behaviors. So people tend to focus more on their healthcare. They tend to have a more healthy diet, and they tend to adhere to more preventive measures and treatments for their health. So again, just to kind of compare and contrast our two curves, in this slide, you can once again really see the difference between our heart rate variability waveforms expressed during anger and frustration versus positive emotions. And the ordered curves help our thalamus trigger our cortex in our rational thinking brain, whereas our disordered curves really are going to trigger our emotional brain. And so again, how that works is that when the disordered waveform triggers the thalamus, we have increased sympathetic activity, which is that part of the ANS that is our regulating our flight and fight response. We trigger our amygdala, which is that emotional memory storehouse. That amygdala associates the stimuli with past memories, and when it's overactivated, it leads to poor and inefficient biological responses. But when we're in a coherent state, We have a rhythmic wave-like pattern that is much more harmonious in its appearance. We have increased parasympathetic activity or vagal tone. We have increased synchronization between our physiologic systems, and we have a much more efficient and harmonious functioning of our cardiovascular, our nervous, our hormonal, and our immune systems. And, this is what is really responsible for a lot of the research that has been coming out on the impact of stress and emotional conflicts on our health. So we have a number of studies that have shown us that there are much worse outcomes in people with high stress in terms of both increasing their risk for heart disease and in determining how they will recover after a heart attack. So there was an interesting Harvard Medical School study that looked at around 1,600 heart attack survivors. And it found that when people became angry during emotional conflicts, their risk of subsequent heart attacks, so a second heart attack, was more than double as compared to people who were able to remain calm and control their emotions. We also know that over 1/2 of heart disease cases and heart attacks are not explained by the standard risk factors of high cholesterol, smoking, or sedentary lifestyle, which leads us to look more deeply into how people handle and manage their stress. And according to a Mayo Clinic study of individuals with heart disease, the psychological stress was the strongest predictor of future cardiac events, such as death or subsequent heart attacks. So what has been positive in all this research is in a very large study of over 5,000 middle-aged people, the people with highest self-regulation abilities, the highest ability to calm themselves and place themselves into more positive emotional states, were over 50 times more likely to be alive and without chronic disease 15 years later than those who exhibited lower self-regulation scores. So from this, we can really see how important it is to learn how to self-regulate and how important it is to cultivate calm. And with stress levels continuing to rise around the world, people are becoming much more conscious, thanks to this research and thanks to the media putting an increased focus on this, of not only the long-term effects of stress, but also how unmanaged emotions really compromise the quality of one's day-to-day life, how they limit mental clarity and productivity, and our ability to really adapt to life's challenges, which we call resilience, in which especially this last year of 2020, we've seen how important that is. So it's commonly believed that, we have little control over our mind or our emotions. And while it may be true for many people who haven't developed self-regulation skills, our research and experience shows us that the emotional system can be regulated and it can be brought into coherence. But of course, it requires practice. And in many of the same ways that it, requires practice to develop mental or athletic skills. So what are some of these ways in which we can promote calm? What are the exercises we need to do to really promote calmness within ourselves and help us develop these more coherent wave patterns? And we're going to dive into that in this last part of our talk. First and foremost, I'm always going to promote exercise. Exercise is one of the most powerful ways that we can learn to have better regulation of our nervous system and counteract the harmful effects of stress. I recommend that. I know people get very busy in their lives, but if people can at least do 30 to 40 minutes, 5 days a week, that has an incredible impact on our ability to manage stress. And it also, of course, can improve our cardiovascular health by controlling our weight, improving our cholesterol, and lowering our blood pressure. People who exercise are known to have a reduced physical response to stress, and their blood pressure and heart rates don't go up as high as people who experience stress who don't exercise will have. It also decreases our risk of depression, which is another risk factor for heart disease. So I always recommend if people need motivation to exercise, to find a buddy, get a pedometer and try to walk 10 to 12,000 steps per day. It helps maintain your weight, but you also get instant feedback and credit for all you do So take the stairs instead of the elevator, park farther away from your destination. And if you're someone who's strong in reward dependence, this pedometer can be a great motivator. Building a strong support system is also a very important way to reduce stress levels. And there's a reason that your grandma's always asking about your relationships and if you have a partner and how it's going or trying to get you married. Over time, we learn that having positive and nurturing relationships in our lives leads to better health. And we know now we don't need to just do this through marriage, but really cultivating supportive relationships and bonds and having at least one person you can rely on takes a heavy burden off of you and provides comfort and also helps you manage stress better. Research also shows that a lack of social support, so not having those relationships in our lives, increases the chance of engaging in unhealthy behaviors like smoking or eating high-fat diets and drinking too much alcohol. So I can't stress enough how important it is to really work on cultivating those healthy, nonviolent relationships. Also, connecting with nature is very, very important tool to help us foster a sense of connectedness with the world. Getting off our tablets, our phones, away from our computers, being outside in nature, learning how to open up all of our senses helps all the forms of communication with our body, but in particular that electromagnetic form of communication that we saw with the heart. Cutting back on alcohol, tobacco, and caffeine can reduce feelings of anxiety, also reduce stress and blood pressure. And of course, reducing stress at work is always a very powerful component. So sometimes we really feel like work, we don't have a sense of control over what's happening and the demands imposed on us. And it is really important to take time away every day from work, doing things that are relaxing and enjoyable. So maybe reading or walking or deep breathing or going out with friends, but definitely important to take a distance from heavy workloads in our life. We know that depression, anxiety, and stress can really take a toll on our health, as we've seen from that research. So if you feel like you suffer from those things, it's important to talk with a counselor or your medical provider and seek help for those. And there are a number of activities and things you can do aside from medications, but medications may be necessary in certain people. At POM, we offer an intensive stress management program that can be done in person or virtually. And this has been an extremely effective tool for helping people with depression, anxiety, and uncomfortably high levels of stress. But it is really important that you express these feelings and get the support you need to help with depression and anxiety. And then the part that we're going to go into, which is something that you can start and do immediately to reduce stress, is learning ways to calm your mind by calming your heart and breathing. And so we're going to discuss this in more detail through the rest of our talk. So this is termed the relaxation response. And this was a term coined by Dr. Herbert Benson, who was a professor at Harvard, Harvard's Mind-Body Medical Institute. And the relaxation response is defined as your personal ability to encourage your body to release chemicals and brain signals and activate your vagal nerve system and make your muscles and organs slow down and increase blood flow to the brain. And Dr. Benson's studies show that breathing meditation promotes better health, especially in those with hypertension. And this is how the relaxation response and breathing meditation started becoming more mainstream in conventional medicine. So we see that people who do engage in breathing meditations regularly enjoy lower stress levels, a sense of increased well-being, increased cardiac coherence, so improved waveforms in that heart rate variability graph that we were looking at, and the ability to reduce their blood pressure and their resting heart rate. The relaxation response counteracts all those physiological effects of stress in the fight or flight response that we were looking at. In a physical state, a deep relaxation really engages our parasympathetic nervous system, which it was that vagal nerve that we were looking at. It can help us with health problems, which can be exacerbated by chronic stress. And Most frequently, we really see stress manifesting in fibromyalgia, gastrointestinal ailments, digestive problems, bloating, insomnia and sleep disorders, high blood pressure, and anxiety disorders and depression. So how do we elicit this relaxation response? And that's going to be the focus of this next part of our talk. But it is something that you can do easily and anytime, anywhere. But you sit in a comfortable position and close your eyes or keep your eyes open. But sometimes it's easier for people to start with their eyes closed and place their feet on the ground and just take a minute to take awareness of your muscles and where you have muscle tension and relax your muscles, beginning at your feet and progressing up to your face. And then we're going to start the breathing technique. And so the first phase of the breathing technique that we refer to as cardiac coherence breathing is to exhale from your mouth, keeping your lips slightly open. And during that exhale, you're going to feel your belly naturally pull in a bit without forcing anything. In the second phase of the cardiac coherence breathing, you breathe in gently and naturally through your nose, letting the air push your stomach out, and again, without forcing anything. So if you all are at a desk or somewhere quiet and you want to take a minute to just practice this exhale and inhale, you take a moment to exhale from your mouth, keeping your lips slightly open. And you feel your belly naturally pulling in. And then you gently breathe in through your nose, letting the air push your stomach out without forcing anything. And you can continue that for about 10 to 20 minutes. You may open your eyes to check the time, but we recommend that you don't use an alarm. And when you finish, you sit quietly for several minutes. Don't stand up right away. And don't worry during this process whether you're being successful in achieving a deep level of relaxation. You can ignore distracting thoughts and let them pass without judgment. Sometimes it's helpful for people to think of a positive word like love or hope or faith. But with practice, the response should come with little effort. And you can practice this once or twice daily. And then after this rhythmic breathing, you're going to just return to breathing, your normal breathing, which is for most people completely through their nose rather than through their mouth and through their nose. The best time to practice this is often first thing in the morning for 10 to 20 minutes to really just set your day off to the right start. But you can also, practice this throughout the day to counteract your own stress response, especially if there's times of the day that you notice become more stressful than others. Most importantly, rapid coherence can be practiced anytime during an emotional crisis or when you're tense. And so to train yourself, we recommend to do these exercises throughout the day and in the morning. But in moments of stress, you can do this for just 30 seconds, and it can cause you to rapidly enter into or regain cardiac coherence and remain calm. A number of studies and surveys have shown that two key capacities for managing stress are first, improving our perception and our actions of self-regulation, and second, controlling the sources of stress in our life. And so if we can't prevent the occurrence of stressful events, we can at least learn how to control our response by practicing this form of breathing, which we can then implement at any time in our day in a crisis. So cardiac coherence breathing has other phases. This first phase of just breathing in through our nose and exhaling through our mouth is just an initial first phase of cardiac coherence. But if you want to dive in deeper, we have feedback technology at Palm that we give people so they can see their own waveform and they can look, where are they starting out? Is their curve jagged? Is their curve more harmonious? And they can see the waveform as they're breathing, and their brain starts to train and understand which breathing can lead to those more coherent waveforms. We also offer cardiac coherence and silence of the mind meditations at Palm. And then at our sister center, the Wellness Agora, which is downtown next to SLU's undergrad campus at the corner of Spring and Park, we offer guided cardiac coherence meditations that you can sign up for and do anytime. Ultimately, cardiac coherence breathing is best combined with positive thinking and working on developing more self-directed character, participating in regular exercises we talked about, and improving your energetic system. And then, of course, if you need to, if you're someone with strong emotional responses and you feel like you could benefit from counseling or cognitive behavioral therapy, that's also a great tool. But using all these things in combination is what will help you elicit the relaxation response most effectively. And so other services that you can combine this breathing technique with are other meditations, as we discussed about the silence of the mind meditation, also body meditations. So the body awakening classes that we do, the Know Yourself series, that's a fantastic tool to really start developing more self-awareness and getting more activation and processing of that third brain, that evolved thinking and planning brain going. Well-being coaching, that's another fantastic tool to develop more self-awareness and self-directedness. And then working on body techniques like our stress management massage, acupuncture and acupressure, biofeedback rebalance sessions, and for people who need something more intensive, the stress management program that we offer. Generally speaking, after practicing cardiac coherence breathing 10 minutes a day for a few weeks, it will be possible to trigger this state of coherence at any time very rapidly. And furthermore, the practice of cardiac coherence breathing will allow us to understand our capacity for self-regulation much more deeply. And by further working on expanding your awareness and choosing activities to promote well-being, you can quickly learn how to bypass many acrobatic emotional situations very quickly. So please feel free to reach out to a navigator at Palm Health if you would like any more information on ways to work on your stress and promote well-being in your life and take these steps to feel better. Thank you for joining us today, and I wish you all well.